Alright, so now I'll be discussing some questions on computing for medicine. So, what is the primary purpose of HL7 standards in healthcare? First, we are covering MCQs. So, it is to enable structured exchange of healthcare information between systems. In HL7 V2 messages, which character is used as a primary field separator, that is the pipe delimiter? Then, what is the relationship between FHIR and ABDM? ABDM stands for Ayushman Bharat Digital Mission, and FHIR is basically Fast Healthcare Interoperability Resources. So, FHIR acts as the technical backbone of ABDM for standardized data exchange. Now, a hospital wants to send a patient's hemoglobin test result to a national health registry, that is NHR. Now, which FHIR resource is most appropriate for representing this lab test? So, the answer is observation and diagnostic report, both. Moving on, which ABDM component uniquely identifies every patient in India, that is Health ID or ABHA? In FHIR, resources are exchanged between systems via RESTful APIs using standard JSON or XML formats. Moving on, the benefit of using FHIR in multi-vendor healthcare systems is it enables data interoperability without changing the internal vendor systems. Now, in Smart and FHIR, authentication and authorization are achieved using OAuth 2.0 and OpenID Connect protocols. So, Smart, basically, I discussed this in the last video. You can go through that. So, for authentication, we use OAuth 2.0, and authorization, we use OpenID Connect. Now, storyboarding in healthcare software design helps to visualize and understand user workflows before the actual implementation. In ABDM, patient consent is mandatory and digitally verifiable via the consent manager. Now, which of the following ensures data privacy while enabling interoperability? So the answer is using tokenized, consent-based encrypted data exchange. Now, in ABDM's data exchange model, how is data consistency maintained even when the hospitals use different vendor softwares? So, by enforcing uniform data structure and semantics via standardized FHIR resources and APIs, we can ensure data consistency being maintained in hospitals. Now, the main difference between HL7 V2 and FHIR is that HL7 V2 is message based, while FHIR is resource based and API driven. Now, a patient revokes consent for a digital health app to access their records. What must happen immediately according to ABDM's framework? So basically, the consent manager notifies the data source to terminate further access once the patient has requested for revoking their consent to access their records from that app. Right. So the consent manager notifies the data source to terminate further access. Now, a telehealth application wants to show a dashboard combining blood sugar readings, blood pressure, and cholesterol for a diabetic patient. Which FHIR resource would the app most likely use to retrieve these values? So that is the observation FHIR resource. Now, some short answer questions. So, Mr. Verma visits two different hospitals in Delhi for diabetes management. Hospital A uses an EHR system from vendor X, while Hospital B uses a vendor from vendor Y. Right. So, Mr. Verma wants his lab results, medication history, allergy, and information about his allergy from Hospital A to be accessible to his endocrinologist at Hospital B. So, from one hospital to Hospital A to B, we want it to be accessible. So both hospitals are integrated with the ABDM, that is Ayushman Bharat Digital Mission, using FHIR standards. So first question is, explain how FHIR enables Mr. Verma's clinical data to be shared securely and consistently between two different EHR systems. Then discuss how the patient consent is managed in this scenario by ensuring data sovereignty, and also evaluate the benefits of using FHIR in multi-vendor healthcare systems like this, using ABDM for both patients and providers. So now let's discuss this. So FHIR based secure data exchange. So fast healthcare interoperability resources provides a standardized data structure for healthcare entities like observation, that is lab results, medication statement, drug history, and allergy intolerance allergies, right? So both hospital A, that is vendor X, and hospital B, vendor Y, expose RESTful FHIR APIs that exchange data in XML or JSON formats. Because both systems follow FHIR specifications and terminologies like LOINC, SNOMED CT, ICD-10, the data remains semantically consistent across vendors. Okay. Now, patient consent management. So, under the ABDM, data sharing only happens after the patient is consented via the consent manager. So, Mr. Verma uses his ABHA ID to authenticate and give digital, purpose-specific, and time-bound consent. Right. So, the consent manager issues a tokenized consent artifact, ensuring that only authorized systems can fetch specific records securely. Consent can be revoked by the patient anytime. It is on his behalf whether he wants to give his consent to authorize those uh, the data, his personal data, or he can revoke it anytime. So consent can be revoked anytime, ensuring full data sovereignty with the patient. Now, benefits of using FHIR. So for patients, it allows seamless continuity of care and reduced redundancy in tests, easy storage and access of their medical health records and previous history in health. And for providers, quicker standardized access to medical records for better decision making. For systems, vendor neutral interoperability and secure integration with ABDM infrastructure. Now, a telemedicine startup wants to develop an app that monitors patient vitals and schedules appointments. So the app needs access to patients' EHRs through ABDM. So describe how Smart on FHIR enables secure app authentication and data access without altering the underlying EHR. And then explain how ABHA health IDs ensure accurate patient identification in the app. So Smart on FHIR is basically for secure authentication and access. So SMART basically stands for Substitutable Medical Applications Reusable Technologies. On FHIR allows third-party apps to connect securely to EHRs. So Smart on FHIR allows third-party apps to connect securely on EHRs. It uses OAuth 2.0 and OpenID Connect protocols for user authentication and authorization. So the app receives a secure access token defining what data, for example, vitals and appointments, it can access without modifying or directly integrating it into the EHR backend. So this ensures modularity, privacy, and auditability. Now ABHA. So Ayushman Bharat Health Account, ABHA IDs, Ayushman Bharat Health Account IDs are for patient identification. So every patient has a unique 14-digit ABHA ID, which ensures a consistent identification across hospitals and apps, right? So when patients log in to the medical or telemedicine app, their ABHA ID links to their health records via ABDM's Health Information Exchange, HIE, right? Now, this prevents duplication or mismatch of records and enables accurate retrieval of patient history. So, due to the unique 14-digit ABHA ID, we can ensure consistent identification of patients across hospitals and apps. Now, next question is a multi-specialty hospital is designing a new module to manage patient referrals between cardiology and radiology departments. So, a hospital wants to design a software system to manage requests or tasks between different departments. Explain how storyboarding can help understand and visualize the workflow before implementation. Suggest a few standard data objects or resources that could represent the main entities in the workflow. So, first is role of storyboarding. Storyboarding is a visual planning tool used to depict the end-to-end workflow. For example, how a cardiologist creates a referral, how the radiology department receives and fulfills it, and how reports are returned. Right. So basically, it's a visual planning tool depicting the end-to-end workflow. Right. Now, it helps multidisciplinary teams like clinicians, designers, and developers to understand user needs, sequence of actions, and the pain points before actual coding. It reduces errors, improves user experience, and ensures clinical relevance, and gives us a holistic view of the situation to be designed before actually coding it. Now, key FHIR resources in the workflow. So first, we have a service request that represents the referral or diagnostic orders. Then we have patient that identifies the individual. Then practitioner and organization representing doctors and departments. Then we have encounter, captures the details of each patient visit. And finally, we have diagnostic report and imaging study, which allows for representing results and radiology findings. Now, India's ABDM is our next question. India's ABDM allows linkage of EHR data between private and government hospitals. So explain how FHIR APIs make this technically feasible without requiring all hospitals to use the same vendor system. So ABDM uses FHIR APIs to standardize how healthcare data is structured and exchanged, regardless of the vendor. So each hospital retains its own EHR system, right? But exposes data through FHIR compliant endpoints, for example, observation, patient, or medication request. So when a patient gives their consent, the ABDM gateway orchestrates the data flow securely between hospitals using tokenized encrypted channels. This avoids the need for a central database or uniform vendor software while ensuring real-time secure interoperability. Thus, hospitals with different systems can still share records accurately and efficiently. So let us discuss this process once again. So each hospital retains its own EHR system but exposes data through FHIR compliant endpoints. When a patient gives their consent, the ABDM gateway orchestrates the data flow securely between the hospitals using tokenized encrypted channels, which avoids the need for a central database or a uniform vendor software while ensuring real-time secure interoperability. So this is how hospitals with different systems can still share records accurately and efficiently. Now explain how combining storyboarding, FHIR modeling, and smart app development ensures that a digital health system is both clinically useful and also technically interoperable. So basically, smart storyboarding aligns technical terms with clinical workflows, provides us an end-to-end framework which we can visually see. So it defines what users like doctors, nurses, patients actually need. FHIR modeling provides a standardized data backbone, ensuring all clinical entities like vitals, labs, medications are represented consistently. And smart app development adds secure modular functionality via OAuth 2.0 and OpenID Connect for authentication and authorization that can plug into any FHIR compliant EHR. Together, they ensure that the system is clinically relevant, it is real workflow based, guarantees technical interoperability using FHIR standards, and enables secure, flexible app integration via smart. The result is a patient centered, interoperable, and scalable digital health ecosystem. Now, our next question is in modern healthcare, exchanging patient data between different hospitals, clinics, and digital health apps is essential for better patient care. However, interoperability is not just about technology. It also requires a strong governance framework to ensure data is shared securely, consistently, and ethically. So, explain why governance is as important as technology for healthcare interoperability. Illustrate your answer with examples from ABDM, Smart on FHIR, focusing on aspects such as patient consent, data privacy, standardization, and secure access. So interoperability is not just technical. Governance ensures data is shared ethically, securely, and with accountability. So we have the technology layer using FHIR, smartphone FHIR, encryption, APIs enable data exchange. So the governance layer, ABDM, has the consent manager, that is, patients control who accesses their data and for how long, and they have the option to revoke their consent as and when they feel their data might not be in safe hands. Then data privacy enforced through encryption and tokenization. Then standardization, mandatory FHIR based formats, ensuring semantic consistency. Then auditability, all accesses are logged and monitored. For example, a digital health app must obtain explicit verifiable consent from the patient via ABDM before accessing any record. If consent is revoked, access is immediately terminated, ensuring data sovereignty. Thus, governance builds trust, ensuring interoperability supports patient rights, not just data flow. And that's it.